So next we have one of my heroes, Dr. Kenneth Stoller. He has been a tireless advocate and warrior in this fight. And he's going up against a medical industry that does not want what he has to say out there. And it doesn't stop him. He's a UCLA-trained pediatrician and a former fellow of the American Academy of Pediatrics for over 2 decades. He left because he saw what was going on with vaccines and the cover-ups. He's an outspoken advocate for the patient's responsibility for their own health. It is our responsibility. So please welcome to the steps, Dr. Kenneth Stoller.
As most of you know, there have been no studies for safety on the vaccine schedule. Now, public health authorities do not concern themselves with safety or adverse events or how often they happen. They believe that the effectiveness of vaccines and its impact on public health trump safety issues. Now, there is no post-market surveillance for vaccines. If we had post-market surveillance, we would be able to determine safety issues. But the problem is, we have a passive reporting system. It's called VAERS, Vaccine Adverse Event Reporting System. And it's passive, which means maybe only 1% of real adverse events are reported. The intentional neglect would be forgivable if vaccines were unequivocally safe and effective, but they are not. And unless we have true benefit risk assessment of vaccines, this intervention cannot be mandated. It is unethical. Now, if physicians were truthful with patients, they would say, look, it's legal for me to offer your child vaccines. They're approved by the FDA, they're recommended by the CDC. But there are risks, and we don't know what the risks are because there are no safety studies. Do you still want them? Sign here. But that is not what happens. And the law that goes into effect in a few months, based on SB 277, literally closed the door on informed consent. It's impossible for physicians to give informed consent and follow this law. So we have a real problem, and hopefully we can overturn this mistake, because it's a big mistake. Thank you.
Thanks so much, Dr. Stoller, for coming out on this rainy day and taking a break from the patients. We really appreciate it. And we really appreciate the voice that you've been for this movement and for truth.